Managed to talk to state health officials tonight, so what are they saying at this point?
Well, Carolyn, in a few moments, we're going to talk with a doctor who will tell us what we need to do and what we need to look out for, because this is a real concern. As you said, 3 deaths so far. The number of cases is up. We need to beware. You just got that mosquito bite tonight.
Yeah.
It's a fresh bite on bass drum player and Roseville High junior Danielle Gladkey amid new concerns this season about West Nile virus. We spoke with parents at the Roseville High football game, many with skin exposed, but trying to keep concerns under wraps.
We told him to spray all the time for mosquitoes, and you know, mosquitoes everywhere. You cannot hide. Yeah, and they practice every day. They're in the grass, they're everywhere.
Does he get bit up a lot at practice sometimes?
He hasn't complained to me personally, but you never know. I know they get me, so I'm quite sure they get him too.
Spray, sleeves. I changed their shorts into pants today before we came out, and then I have sweatshirts with us. So they're going to be covered, definitely.
According to the Michigan Department of Community Health, 3 people have died in the Metro Detroit area from the virus. There have been 47 cases so far, and 22 blood donors have been identified carrying the virus but not showing symptoms. Health officials say the numbers keep rising.
Of the cases that we have seen this year, though, the 47 that we have as of today, last year we only had 34 cases and 2 deaths for the entire season. So we've really had a dramatic increase very early in the year, and we're seeing that the cases are continuing to rise.
Dr. Sean Jakar is with us of St. John Hospital, internal medicine and geriatric specialist, and his wife, Tui, Dr. Jakar, as well, family medicine specialist. And so, doctor, you can carry the West Nile virus and not show symptoms.
Absolutely. About 80% of the people who actually get infected with West Nile are asymptomatic. Only 20% actually get West Nile fever, where they get fever, headache, vomiting. And actually only 1 in 150 will get neuroinvasive severe West Nile disease, where it can affect your brain, spinal cord, meningitis, meningoencephalitis, which involves the covering of the brain as well as inflammation of the brain, and it can even affect the spinal cord as well.
Wow. So, Dr. Jakar, how do you protect yourself? We know about the sprays, but when you see a little face like this and little legs out, I mean, what do you do?
Yeah, so primarily with the sprays with DEET are important to use, and not on the skin or under clothing, but over clothing. For kids, it's important not to use oil of eucalyptus, and under 3 years, it's not recommended. Also, DEET sprays are not recommended for kids under 2 months. Okay. It's important to cover their arms and their legs, and cover baby strollers with mosquito netting.
Okay, thank you. Some good, interesting tips, you know, that go outside of just the regular sprays.
Yes.
And, of course, we'll have those for you on our website, WXYZ.com. Thank you, Doctor.
Yep.
Doctor.
Thank you so much.
Live in Grosse Pointe Woods, I'm Glenda Lewis. Steve and Carolyn, back to you.
And especially tonight, we thank the doctors for stepping outside amongst the mosquitoes to talk to us. Thank you, Glenda.